That's the so-called serial stowaway back in 2015, promising to never again sneak on an airplane. Guess what? She did it, and she did it again and several more times. Her name is Marilyn Hartman. She looks so unassuming. She was arrested for trespassing yesterday inside a terminal at Chicago's O'Hare Airport. Just days earlier, she was caught in London after she allegedly snuck onto a plane in Chicago. She didn't have a ticket or a passport. In fact, she's admitted doing this many times over the years, gathering quite a collection of mugshots. What on earth compels someone to do this? Joining me now is clinical and forensic psychologist Dr. Judy Ho, coming in on a story that we haven't. This is kind of, I was going to say it's outside of your wheelhouse, but it really isn't, because it's looking at human behavior and what drives us to do things. When you saw this story, what crossed your professional mind?
Well, the first thing is, how did she get away with this so many times? And I think part of it is her demeanor. She's this 66-year-old, kind of pleasant-looking woman.
Looks like she could be Envy's grandmother.
Exactly. So why would you think somebody like that would do something like this? And then, of course, it's like, well, what is the motive behind somebody who might do something like this? And she does have some history of depression. That doesn't cause somebody to do something.
Well, I was going to ask you, many people suffer from depression.
Right.
It doesn't necessarily go hand in hand with delusion.
Absolutely not. But sometimes it's a co-occurring illness with something like delusions. And delusional thinking can be due to a variety of different things. It could be something as severe as schizophrenia, where it's a primary psychotic disorder, but it could also be substance-induced. There's so many different reasons. And for her, because she seems quite high-functioning, but has just this one area that she's been delusional about for maybe 20 or 30 years.
That we know about.
Well,
this is the only
true.
one that is making headlines, and really making headlines.
Exactly.
So when you talked about having a delusion, she's very high functioning, because she's able to outsmart the TSA.
Yes.
And look,
multiple airports.
Right, at multiple airports.
Multiple countries.
And get across borders and cross oceans. So help me understand that.
Well, even though I haven't seen her myself or
Yes.
treated her, based on the history that I've looked at, she appears to just have this one area, which in our clinical diagnostic manual, we have a type of condition called delusional disorder.
Okay.
So other than a pervasive delusion that has a certain theme to it, she certainly has a theme here, feels like there are people who are after her. She even has said that Obama might be a ringleader. I mean, these delusions have carried out for probably 20 to 30 years at this point. But nothing else is really that disturbed. She's not disorganized in her thinking. She's not experiencing hallucinations. And so somebody with delusional disorder could have this for decades. And until it really starts to impact their life like it is for her, they can even be undiscoverable for many years.
She has said, I'm not going to do this again, but a compulsion is a compulsion.
Exactly. And she's just responding to a delusion. So if we understand this as a delusional piece of her thinking, that she must get away from people who are trying to harm her, then the compulsion will continue to occur for as long as the delusion is alive.
When somebody's exhibiting that kind of behavior, if this is indeed what she has, the people around them would notice this. What are they to do?
Well, I think that in our culture, we oftentimes think we just need to leave somebody alone. It's a very individualistic culture, but we really do need to speak up, right? And so in collectivistic cultures where people often live in communities, this happens a lot less, because people will notice right away and try to get that person help. I think that we should start to do that. She has kind of evaded this because she doesn't have a lot of deep connections with friends.
Yes.
She hasn't talked to her own family in years. And so I think that's why this is happening, because she's kind of alone a lot, and she's been homeless many years as well, with intermittent periods of moving around a lot.
Doing this? I mean, from when you look at people that have these kind of compulsions and this kind of disorder,
I think she might, until the delusion is treated. And so we have a couple of ways to treat delusions. There are medications, therapies that can help reduce them. And cognitive behavioral therapy is one in which we can engage her in reality testing. So we can actually challenge her on these delusions. Okay, well, you think these people are after you. What's your evidence for that? And slowly try to chip away at these delusions and help her to recognize what's reality and what's in her mind.
Yeah, it's really something, and it's really posed a big challenge to these airports and these officials trying to deal with this very, nice-seeming woman who seems to outsmart them at every turn, but they keep catching her, and she keeps doing it. It's going to be one of those that just keeps going round and round. Hopefully she's going to get the help she needs. Judy Ho, always a delight to speak to you. Thank you so much for being here.